requirements. That was a quick one. You can see Southwest Louisiana Health Area Education Center. If you don't know, these are our congressionally authorized entities, and one of the things we do is try and recruit young people into healthcare professions. Another topic for a different talk would be the severe shortage we have of people in healthcare professions. Nursing is really hurting for people, but so are a lot of the allied health fields, medical assistants, surgical technic. We need a lot more people to go into medical jobs. So that's partly what Swallowhead does. We go out and help recruit, train, and then retain people who want to work in health careers, specifically people who are already here in Louisiana, right? This whole grow your own philosophy. 10 years ago, you can see we were awarded the contract to become the Navigators for the state of Louisiana. And so for the last 10 years, that's the work we've been doing. We talked a little bit about this here at the top. One of the big things we've talked about before with some people, one of the best services we offer as these navigators is we're providing a neutral service, number one. It's totally free. Right, we're funded through the Department of Health and Hospitals, through CMS and the state of Louisiana. So we have no stake in what solution people choose, what insurance they may or may not want. Doesn't matter to us at all. Right, we have a grant to go out and offer one-on-one assistance to help walk people through this process of finding an insurance coverage plan that will meet their needs and the needs of their family. We also do some other education-related pieces to that, and I'll talk a little bit more later. We've got, there's a significant training that goes into becoming a navigator. We study a lot about cultural competencies, how to meet people where they are. We have language services. We offer telephone assistance, virtual assistance, one-on-one assistance. We can provide translation services if the language is that significant of a barrier. So there are a lot of options for us to help get people where they need to be. This gives you an idea of where our offices are around the state. You can see we've got 7 of them. They're strategically positioned in most of the larger cities in the state of Louisiana. We've got 3 to 4 navigators in each one of those cities. We can come and work with you at your house. We can make an appointment for you to meet at our office. We can make an appointment to meet at a library, anywhere else in your community, in addition to the other opportunities we talked about, either virtually or over the telephone. We cover all 64 parishes. Nobody is immune. And we talked a little bit about this, how we make a difference, right? Because everybody knows, and there's some folks from the insurance industry here. I mean, part of this is saying that what we want to do is present options to people. We're not trying to encourage people to take one plan over another. What we're saying is, based on what you've told us as the consumer, we've entered that information and we've pulled up these several plans that might be good for you, that may work for your situation. But you have to ultimately decide which of those plans you want to pick. Right? We can't say the majority of people pick these plans. We can't say this would be the best plan for you. That's a decision you need to make for yourself. So we really do stress being impartial. We talk about making sure that people understand the difference between all the terminologies, right? What's a deductible? What's a copay? This is a great plan for maybe for in-office visits, but it's not paying very much for your prescriptions. So are you more interested in prescriptions? So we also try to help people see the totality of what they're really looking for based on the conversations we've had with them. We also put out a newsletter if you're interested in getting our newsletter. One of the ways that we've had the most success, and this probably isn't a surprise to you, because truly, remember what we're talking about. We're really talking about a lot of the most vulnerable people in the state. So one of the best ways that we get to contact with people, we have an 800 number, we have a website, all of that's in this presentation. But truly, one of the most effective ways is through direct referrals. Right? And so we just re-engaged over the last 6, 7, 8 months because remember, we've been doing this 10 years, right? But we know with this Medicaid unwind, there's going to be an enormous tidal wave of people that are going to want to go through this process. So we've spent the last few months re-engaging with over 800 partners around the state who can do direct referrals. So if you show up at the urgent care or something and they say, oh, you don't have insurance, they can refer them to us. Right? If you show up at a health unit and you don't have what you need, they can refer you to us. We've partnered with doctors' offices, physicians' offices, police juries, parish councils, anyone that we can use who may encounter an individual who perhaps needs a better plan or some kind of health plan altogether, and they can refer them to us. So I think that's a huge benefit. We get a lot of our consumers through that direct referral process. It's also a very simple process. You'll see later in the presentation, all you have to do is scan a QR code, and it gives you all your information. It goes to our call center, and then our call center distributes your information to the regional coordinator wherever you live in the state. So it's a very, very easy, seamless, streamlined process. We also go to community events and health fairs. You may have seen us at different places. We like to engage with people, whether they need our help today or not. They may need it somewhere down the road, or they may know someone who needs it. Part of this is about getting out the word so that people can understand, I may not need this, but I think my neighbor might. So let me give my neighbor a little tip. And you can see we talked about some of these other things. The Medicaid Unwind is partially, or primarily really, why we're here today. You can see, if you don't know what the Medicaid Unwind is, the public health emergency that was declared by Congress is ending. What we anticipate, or what we know really, is that means states are now allowed to revert back to the original Medicaid plans they had before the pandemic started. When the pandemic started, individuals were allowed to stay on the Medicaid rolls without having to verify their status. Prior to that, there was a lot of churn on the Medicaid rolls as people's status changed from month to month. So for this continuous coverage provision, that was during this public health emergency. People did not have to re-engage with CMS, the state's Medicaid services, so they were allowed to stay on Medicaid whether they were originally eligible based on the old guidelines or not. That provision's ending. And so now the state is reaching out to people to say, hey, you need to update your status. You need to tell us how many people are in your household. You need to tell us if you've gotten a job. You need to tell us if you have a new phone number. If you changed addresses, we need to know all that. All of that's factored into your eligibility for Medicaid and let's show. If you don't know what Medicaid is, it's really a health insurance program for people that are underserved who really need some kind of health coverage. There are very strict guidelines that are related to the amount of money you make, the number of people in your household. You can find out all of that information online at the federal government, at our website. Numerous places can give you some information about that. It's different from Medicare. Right? A lot of people get them mixed up or conflate the two. Medicare is for people over 65 and a very, very, very small number of disabled individuals or individuals who are not over 65. But primarily Medicare is for people over 65. That's not what we're talking about. We're talking about unwinding Medicaid in the state of Louisiana. And you can see these are some of the primary insurance carriers that come up with the marketplace. If you don't know what the federal marketplace is, because you get insurance through your provider, the federal marketplace was created as part of the ACA Act during the Obama administration. Essentially is a safety net provider. It's a place where we can find low to no cost health insurance coverage options for individuals who need it. Our job is to get them to this marketplace where they can see all of the different plans and their eligibility. So we don't privilege anyone. We don't check or select a plan for people. But if you were to walk into one of our offices today, work with one of our navigators, you may be eligible for 6 or 8 of these different plans. Each of these different plans may have different levels, on the amount you would pay every month, or the amount of copay when you go and do a doctor's visit, your prescription drug coverage, any of those things. A lot of variables, which is why it's important to have that one-on-one conversation with a navigator. We talked a little bit about this, so I'll go quickly, but this is the meat of the presentation. So if you don't get this, let me know, and we can go over it a little bit more. The unwinding is really just an informal name for saying that now that the public health emergency is over, this huge number of people that ballooned on Medicaid, they're going to be unwound now, because now we're reverting back to the original pre-pandemic Medicaid eligibility rules. And so that means that all the people who joined Medicaid since then may not necessarily be able to remain on Medicaid. This is why it's so critical they update their status, because the state needs to know how many people are in your house, how much money do you make, what's your phone number, so we can reach out and verify these things. So that's the unwinding. We're taking this apart over the next 15 months. It's not an overnight thing. It's not all at once. There's not going to be a huge deluge at one time. There's a staggered, streamlined process the state's worked out for the next 15 months to do this unwind. It ends in 15 months because in 15 months, the federal government's cutting off the spigot. Right? In 15 months, the federal government's not going to give the state of Louisiana money to cover all of these extra people on Medicaid. So the state needs to get the Medicaid rolls back to an accurate level, whatever that level may be. You can see this already started. We've been doing these presentations. Our organization, the Navigators for Healthy Louisiana, has been in existence for 10 years. Our parent organization, Swallahek, has been doing health education and information for 30 years. We started this program last year, actually. We knew this unwind was coming. We had a grant from Blue Cross Blue Shield to get started with this process so that we could accelerate and amplify what was happening, because we were concerned that there was going to be a huge number of people that were immediately kicked off the rolls. At that point, we didn't have any idea what the plan was going to look like. So we've been involved in this space for almost a year, knocking on doors, talking to people, engaging face-to-face, one-on-one. As I said, this last one at the bottom is pretty important. These individuals haven't been contacted in 3 years, right? Once the pandemic started and the public health emergency kicked in, if you got on Medicaid, no one's called you since then. So you may have doubled your salary since then. If so, you're probably not going to be eligible anymore. But you also may have moved in your grandma and your mother-in-law. So your eligibility status has definitely changed. So the state of Louisiana needs everybody to update their status. And that's partly what we're doing here, is we're doing this outreach effort to help people. And you've probably seen the billboards, right? They're all over saying, update your Medicaid status. And this is why, because no one's checked their status in 3 years. This is a very interesting statistic. Being neutral, instead of saying shocking, I'm going to say interesting, right? 42% of the state's population's on Medicaid. That's a significant number, folks. I mean, that's a very significant number. And truly, it may be a little bit more than that. I saw one the other day from the state. It may be around the 45% range. So that's almost every other person in the state of Louisiana who's on Medicaid. That's not good news for the healthcare industry. It's a total of more than 2 million people in the state. 770,000 of those people came on since the pandemic, right? So those 770,000 are the ones who are at the front of the line potentially for being booted off the rolls, because they were previously not eligible for Medicaid until the pandemic happened. This is, again, why it's so critical everyone updates their status. We know there's a range. CMS and the Robert Wood Johnson Foundation analysts both sort of anticipate that somewhere around 280 to 350,000 of the 2 million people in Louisiana on Medicaid may be kicked off the rolls. Why they're being kicked off? Yeah. And so why they're being kicked off is a different reason, though, because you may be kicked off because you didn't update your status. Technically, you might still be eligible for Medicaid, but if you don't let us know and update your status and respond to the state in a timely fashion, you may be excluded from the roll for no good reason. This is why it's so important that all of you go back out to your communities, back out to your organizations, to your newspapers, your TV stations, and help people remember they need to update their status if they're in Medicaid. I told you this is going to take 12 to 14 months to update all this eligibility. The state's doing this in batches, so they're going to do 169,000 people per month. That's going to be spread out around the entire state. It's not 169,000 in one community. It's not by zip code. It's 169,000 every month distributed throughout the state. We did that to spread out the workload for the existing navigators on our staff, the existing CMS workers at Medicaid offices around the state, and for the people at the main office in Baton Rouge. Everybody's getting a renewal letter. It'll be a pink letter if you've seen some stuff about pink letters. Not everyone will get that letter right away, though, because you may not be in a batch until December. So if you don't get the letter, you're not off the hook. You just haven't received your letter yet. Everybody who's enrolled in Medicaid will ultimately get a letter advising them to sign up or to go onto the website and do it themselves, to find a navigator or find someone who can help assist them in updating their status. The good news is we believe about half of these people will be automatically renewed. Right? The state can use other state databases to verify income levels. They can look at other criteria that are not necessarily housed in the Medicaid office, but that are state agencies. So they believe that as they run this automatic renewal process, hopefully their estimate is that half of those people will automatically be renewed, whether they update their status or not. But you don't want to be in the half when you need it, right? You don't want your insurance gone and then you go and find out at the hospital that you don't have it. People's coverage will start to end on July 1st. The reason for that is because as soon as you get your letter and you're notified, you only have 60 days to update your status, and then they will start eliminating. Right? So let's say you get a letter last week, you have 60 days. If you don't update in 60 days, then the state is going to roll you off of the Medicaid rolls. If you don't get your letter until December, you have 60 days after the time you get your letter in December before you need to update and risk being disenrolled. And you can see some of the first pink letters went out in March. We said that already. Everybody has to do this. You can imagine the challenges. I mean, we're trying to raise awareness through public awareness. The state obviously has staffing shortages. They're not capable of handling the significant number of people who are coming off the rolls. There's a long wait time at the call center. You can imagine if 10,000 people are calling these phone numbers. A lot of confusion. I mean, truly the best solution, right, is for you just to go online and update your status. But if you have literacy challenges, if you have digital fluency challenges, that's not a good option for you. And some of the people we're talking about truly are some of the most vulnerable. They need that little bit of one-on-one assistance. Okay. If you are removed from Medicaid, right, big question, then what you want to do is contact a navigator. Because if you were eligible for Medicaid, the chances are you're probably going to be eligible for a low to no cost marketplace option. And so this is one of the great reasons that we're involved, because we have partnerships with all of the people around the state who are doing this outreach effort to say, hey, update your Medicaid status. And as people update that status, when they find out if they're not eligible, we have partnerships with those people to make this a seamless transition to say, hey, we see you're not eligible for Medicaid anymore. Talk to this person right here. They're a certified navigator through the federal government. It's free one-on-one assistance, no hassle, no problems. They're going to walk you through it step by step. So the state's goal and our goal is for that transition to be seamless. We got a huge head start, right? We did over 3,000 people so far, just ourselves. Our navigators have already reached over 15,000 people this year, so we are really already churning with a huge boost of momentum. You can see here at the bottom too, this is interesting, the plans aren't stagnant. So if 7 or 8 years ago you checked into this and you said, oh no, I'm not interested, this is no good, the pricing of the plans is always fluctuating. And recently some of these plans have really been affordable for people. So even if you thought it wasn't for you in the past, it may be now. We talked a little bit about the marketplace, but just to reiterate, the marketplace is essentially a place in the cloud, right, where all of the insurance carriers who are participating in the state of Louisiana put forth their plans based on what people enter as their eligibility requirements, what their needs are, what their status is, their age, those kinds of things. Once all of that's determined, they get a slate of options that are presented to them. We can explain all of those options in a very impartial way. They may also be eligible for some tax credits that could lower their tax premiums. This stuff gets very into the weeds, but just so you're aware, as you're going back out to educate people, these are opportunities and options that people have. So even some people that you might think, would never need some kind of marketplace coverage may actually be interested and may prefer to take the tax credits over something else. And you can see, and when I say low to no cost, you can see some of these are $10 a month. So when you go back to work and you see what you're paying and what your employer's paying, our organization is paying a significant amount of money for our employees' portion of the health insurance, a lot more than $0 to $10. And each one of the federal marketplace plans, remember, part of ACA is there's no more pre-existing condition exclusion. So if you have cancer and you say, oh, well, now that I'm off Medicaid, I'm in trouble because no one's going to give me a health insurance plan. That can't happen anymore. The insurance companies have to offer people with pre-existing conditions coverage. And you can see all of those federal plans in the marketplace have to have these essential health benefits. They've got to have preventative services. They've got to be able to do pediatrics, maternity and newborn care. That's a big one for Medicaid. That's also in these plans. Mental health services is a growing area of concern for a lot of people in healthcare and I'm sure also in the insurance business. Prescription drugs, another important one, and I'll say myself too, the prescription drug coverage varies significantly amongst the plans. So that's one of the other areas we focus on a lot. It's not just your copay when you make a visit, but what's going to be the ongoing maintenance cost for your medicines. This gives you an idea of who is eligible. The rules are very strict. They do not deviate at all. You've got to be a U.S. citizen. You have to live in the insurance company service area. There are several areas in the state of Louisiana that insurance companies don't cover, right? So you may have 3 companies that cover an area in one part of the state, and you may have 6 insurance companies that cover an area in another part of the state. So it's not just as simple as saying, I want insurance company Y. They may not offer plans in your area of the state. What's some other important pieces on here? You can remain covered if you're on your parents' plan until you're 26. That was another big feature of ACA, if you remember that. There is a special enrollment period because of the unwinding. Normally that enrollment period's at the end of the year, the open enrollment, OEP. But because of this unwinding, we do have this special enrollment period, so you don't have to worry about that. You can see at the bottom, individuals from 100 to 138% of the federal poverty level are eligible. There's some charts you can look at to see what that dollar figure actually is based on the size of the household, right? Because that's what it's determined. It's not like if you make less than $20,000, you're good to go. It depends on how many people in your household, and then that will determine what your income requirement may be. I was going to use another example, though, one that I've talked to some people about earlier, and you can see this piece where it says you've got to be a U.S. citizen, and that's true. But here's the difference: if mom and dad are not U.S. citizens, but child was born in the United States and child is a citizen, child is eligible, right? So don't think, oh, well, my grandma lives with us and she came from El Salvador, so we're not eligible. If you are a U.S. citizen, you are eligible for getting some of this coverage. It may not cover the mother or mother-in-law from El Salvador, whoever it is, but you as an individual, if you are a citizen, you are eligible. So that's an important distinction because some of the families we're talking about have questions. They're multi-generational. They are living in different kinds of situations where different people are in the household. So all of those are very specific things we can look up as navigators and help walk you through that process. Oh, here's the chart. So you can see if you're a household of 4, then if you make less than $38,295, you're going to be eligible for Medicaid. But if you're just a house of 1, then and you make less than $18,000, you're going to be eligible. These are the people not eligible. You're not eligible if you are currently incarcerated, if you make too much money, obviously, over 400%. If you're offered covered at work, and there's most people don't use this, but there is an option. If you're offered coverage at work and you turn it down, you have to meet some other criteria. You have to be eligible, obviously, for the Medicaid guidelines, the CHIP guidelines. You can't be a dependent on someone else. Let's see, what else? If you're in the country unlawfully, we just talked about that. Here's some of those protections, right? So there's no more pre-existing exclusion, so you can do that. The ACA also eliminates that lifetime cap. Remember, so if you're thinking, oh, well, I've had cancer for 5 years, I've already spent, $2 million, that's not an issue anymore. You can still go through this process, still become eligible, still be offered one of these plans. There is an appeals process. We can also walk you through that appeals process. If you're denied some type of coverage, we can help follow you through or walk you through that process and follow along with you. And you can see there's consumer assistance programs in every state. So if you're here today and you're talking to somebody else in a different state, these all exist in different states. They may have some smaller variations depending on what state it is. But the one here, Navigators for Healthy Louisiana, is our organization. This was that direct referral process I was talking to you about. We've actually won a couple of awards. We've been praised very highly. We have some interesting outreach programs. We've partnered with barbershops and beauty shops to use those individuals as ambassadors to make direct referrals to us. So as people go to get their hair cut or their hair fixed or their hair done, they can talk to people, obviously, and if they discover that this individual may need some kind of health coverage, they refer them to us. And so we have a little partnership with different ambassadors in different parts of the state that help get people who need us to us. And also, like I said, we have these posters all over the state. You can scan this QR code. It takes you to a form you can fill out. We can get in touch with you and begin this whole process. No cost, no obligation, no pressure. We're trying to do what's best for everyone. These are some ways you can reach out to us. We're on Facebook. We have a website. We do our newsletter. We have a ton of other resources. If you're looking for resources, you want to put it at your business, you want to become a direct referral partner, let us know. We can do that. And we also do a variety of other things, right? As Swallowheck, our parent company, we do diabetes screenings. We do blood pressure checks. We have a variety of other health-related educational programs we do for businesses, for groups, for children, all over the state in every region. And these are truly your best contacts, right? I'm not your best contact, right? Just like Biden isn't the best person to ask about this. I'm the guy who's overseeing all this, looking at all of this, making sure the resources and the money and time are aligned with where they need to be. The real expert at our organization is Taffy Morrison, Jacob Shea, James Ducote. They've been doing this for a long time. They've worked with hundreds and hundreds of individuals in these programs. They've been from the start as the program evolves. They know the good and the bad about it. If you're interested in Medicaid issues, the unwinding process, how that's working, what some of the state's concerns might be, how it affects Medicaid, how it affects the state budget, all of those are issues that could be directed to the state. But Courtney Foster is a Medicaid policy analyst with the Louisiana Budget Project. She's been keeping up with a lot of this. She's another great resource. We partner with her frequently to do different presentations around the state around this topic. So if you need some more information, these are reliable resources. That's not my old librarian heart, right? I want you to get quality, credible sources, especially when you're online. This is two great places to start to get information. I think that was all I had. I'm not sure where my time is. 12:45. We on time, John? Perfect. All right, we got a question. So I think the question is about, will the debt ceiling, the current debt ceiling debate affect us if it goes the way we don't want it to go? Right? Is that the question? Directly, I don't think so. Indirectly, probably. I mean, I don't think the full ramifications would be known for a while. I mean, our funding is secured for a little while, right? We can continue on and carry on with this work with what we have and what we've been doing. But ultimately, I suspect if it drags on, we could have some kind of issues. But it's also maybe one of the things that's protected. Right, we just don't have enough specifics to know at this point, you know, what may evolve from those discussions.
Again, also the question is, how will it affect Medicaid? And again, let me say, I think an agreement will be reached in the nick of time. But if it doesn't get reached, how will it affect Medicaid?
The question this time is the person asking the question is hopeful that an agreement will be reached in the nick of time, but they're also wondering what will happen to Medicaid. I don't have an answer for that. You know, I'm not a Medicaid expert. I'm not a Medicaid policy expert. Our role, you know, is to take what Medicaid puts out, get out into the communities one-on-one with people and really help them try and understand and utilize and fulfill the goals of whatever Medicaid policy comes down the pipe.
Let's take an extreme example, or maybe not so extreme. You're from South Louisiana. You left school in 3rd grade. Always earned a living fishing and odd jobs. Work for cash. You may not even have a Social Security card, and you're recently disabled because some roofing shingles fell on you. And you're eliminated in month 14. What do you do?
So the question is, if you're an individual who maybe didn't finish school, who's been maybe working a job that's a cash job, right, and maybe don't even have a Social Security card, you know, you haven't really been a part of the system the way traditionally most people are part of the system. And then what happens if you're eliminated from Medicaid at some point in this process? That's something we would have to deal with on an individual basis with the individual, right? There's a whole series of questions. I may not have said, but in order to be certified, we have some other folks who are certified here today to be an application specialist, to be a navigator. You have to undergo some pretty significant federal training to understand all of the different laws and guidelines that are involved. And each of these cases are typically on a very individualized basis, especially when you're dealing with disability. You're dealing with individuals who may not have the documentation they need. And so those cases are really best worked one-on-one, which is the assistance we offer. Now, is that going to happen in a timely fashion? Probably not, because this is happening in every state, not just Louisiana. So as other places are unwinding, at the federal level, you're dealing with a huge number of people. Ours is a relatively small number. But these cases, and the Medicaid office in Louisiana, I think, is prepared. They understand. They've tried to do their best to keep track of this. They had rigorous data before the pandemic and had a very good understanding of the structure of what was happening in Louisiana, what that looked like, and they're prepared for these kinds of situations. And anything we can't do, obviously we can refer back to the actual Medicaid offices. And they do have people, they're overwhelmed with the number we have coming off the rolls. But as people come off those rolls and we start to relieve that pressure around the state, I think what we'll see is that the cases who need the most attention are the ones that are going to get to the front of the line. Because truly, we all believe, everybody who's been involved in this, who's been watching this for the last 6 months or so, a significant number of these people are going to be renewed very easily, right? I got a new cell phone. Okay, just give us the number. Yep, all your information's the same, you're good to go. And it's a done deal. Right? A few people are going to say, well, my parent got COVID and they moved in with us. Okay, that might change your status. Now you have another member in the household. Let's look at your income. So that's a little bit more of a gradient. And so the case here proposed in the question is one of the most significant, where we would need a lot of one-on-one attention to try and get through those processes. But truly, all of those processes are outlined and mapped out. If you are interested in undergoing the Navigator training, it's a very complex and convoluted training system, and you're quizzed on it. You have to pass a test. I mean, it's a rigorous program to become a certified navigator.
This is a two-part question. Number one, personally, I'm retired from the city parish. I'm 77 years old. You got to review a lot of this stuff when it comes to medical. You know, or they're going to be changes and you'll get a letter. Then you get people call you on the phone saying, hey, you eligible for free
Right.
brain scanning and all that. And you don't never know, especially in my age, whether it's spam or whatever it is. Now, my city parish now, they normally, if you don't answer, they just automatically remove you, right? So I don't have to deal with this Medicare, not Medicare.
Right, right.
So that's another thing we talk about. The other question is, I saw you say the challenges y'all have is reaching people with this information. Every health, they got Medicaid program, Medicare programs, they got everything, all right. Blue Cross Blue Shield, like we have, they all have people, or they even have infomercials.
Right.
What is the state do? You don't have nothing in the budget. Maybe on the LPB or somewhere, somebody can look it up and explain that. You did a tremendous job.
So there's two questions. The first one is a really great question. It's something we talked about before the presentation, actually, and it's about fraud. Right, so if you've worked with some of these vulnerable populations, if you've been in social services in the state, if you are a person whose car warranty expires several times a week, that you know there is this whole industry that springs up around opportunities. Right, and so part of what the question is how can we distinguish what's real from what's not real? How do we know what's a scam caller and how do we know what's not? That's exactly why we've been doing all of this outreach. That's why we have the billboards, why we're running the commercials. It's why we're out talking to people. It's why we're trying to get to legitimate resources. It's why we're partnering with credible direct referral partners. Right? When you go to the Office of Public Health, when you go to your health unit, when you go to your barber, when you go to your dentist or your urgent care, we want you to know you can trust them. We've built that relationship with them. We are together in this effort. We are aware of this fraud. We anticipate this ourselves, and one of the things we've been talking about, and one of the ways we do some of this, because we literally go door to door. Right? I mean, we're on the ground. This isn't a 30,000-foot level, let's reach out to people. That's what the state's doing. They've asked us to go deeper and literally go neighborhood by neighborhood, door to door, individual by individual. And so part of what we're doing is trying a two-phase approach where we initially come into a neighborhood and we say, hey, here's who we are, what we're doing, we're not asking for anything from you today, because we want you to know we're legitimate. Here's our credentials, here's our name, here's our information, our flyer, our phone numbers. You can call and verify any of this. We don't want you to be preyed upon, because we know that's an alternative. It's happening every day, all day. And so then we go back later, if we're doing the door-to-door, neighborhood-by-neighborhood approach, and we try to assuage any concerns people may have, and follow up, essentially. As I mentioned before, a lot of our business is through direct referrals that come already from trusted partners. We partner with a ton of faith-based organizations, right? If pastor says it's okay, it's going to be okay. We literally have people on the ground at meetings, in the housing projects, at your church, at fairs, at the school. We just put Navigators into the Department of Education. Right, so now we've got educators who or we've got navigators who are working with educators to ensure that any relationship you have with a teacher or a school principal, you can rest assured that we are a trusted partner and they are referring you to us. So that's one of the ways where we're doing this. The other part of his question was about the marketing behind this. The state is doing the majority of its marketing. One of the things I did not mention is the awareness piece and outreach around the Medicaid Unwind. There are 5 on-the-ground contractors who each have 8 to 10 or 8 to 12 parishes that we're doing. So we have regions of the state. There are also another 6 groups that have been contracted to do specific outreach around the Unwind. For example, there's some doing outreach at sporting events. Right? You get 100,000 people to show up for an LSU game. That's a lot of folks. It'd be nice to have somebody there doing Medicaid outreach. And so we've been trying to anticipate how do we get to some larger gatherings too in a face-to-face model. We do have some commercials. The state has commercials running on TV. We do a ton of local radio, which we found is a great way to reach people, especially because it seems strange to me, but a DJ is a trusted partner for a lot of people. They listen to them every day. They trust them. And when they say, hey, we're working with Navigators of Healthy Louisiana, people will reach out to us. So a lot of a variety of ways. I mentioned before Southern University has a group that's doing some canvassing and outreach on their campus. There's some other smaller entities that have been given some grant money from the state to do outreach, especially targeted outreach in areas where we know historically there have been high numbers of Medicaid patients.
How big is your organization and what's the size of your budget?
The Swallowheck organization, we've got about 75 employees on our payroll. Our budget's probably around $11 million a year. We've got a variety of state contracts, federal contracts. We have a significant number of private grants for the different kinds of programs we do. For example, we do a Heck of a Smile programs where we partner with schools and we go in and we will have a dentist come for free and examine the teeth of every kid in the 3rd grade. And if they need to have their teeth sealed, then we do the free sealant. And so we have other programs that do, we've got a civilian corps program where we're training people in their community to be health ambassadors. We train community health workers, which if you're in the healthcare space, you know that's sort of the future of healthcare, where we send out these trained individuals who are community members. They're your neighbor, and they're looking for things that happen, and as they happen, to spread information. It was a great strategy that worked during COVID, and I think nationally the federal and state governments are really going to try and replicate that. Navigators for a Healthy Louisiana is just a subsidiary of Swallowheck, so all of that's rolled up in there as well. I think we have one more question, right?
So I know awareness is always a big issue in anything like this. But there's another recent change that I think there's almost no awareness of, and that's the family pledge. And there's a lot of vulnerable population that falls in that gap where they can't afford the group coverage, but they don't realize now they can get the subsidized coverage because they fall into that space. And do y'all do any kind of outreach, or have you had much
We haven't had much response. If people ask the question, or if in our conversations with people we're engaged with that comes up, obviously we bring it up as an option. The question was about the family glitch, that you may make too much money for your family to be eligible, but you might still be otherwise eligible for some subsidized coverage. And there's several of these little different opportunities in there, like one of the ones I mentioned before, if you're offered health care insurance at work but you don't take it, or if your spouse is offered coverage at work and they get it but you don't. So there's several of these little things, but a big push around, a big marketing effort, no, not at this time. I mean, the majority of our people are people that are typically on and off the rolls, that are new people coming into the health space, and a lot of the people we work with are eligible for Medicaid. If you don't know if you're eligible or not and haven't been on the roll, you're not one of those 2 million people, and you walk into the office and we sit down with you, the first thing we do is see if you're eligible for Medicaid. And if you are, then the whole process stops. You're good to go. And if you're not, then we move on to the next stop. And so it's a variety of people that come in with a variety of different conditions. Every day is different, and the valuable service, or the value in what we're providing, is that one-on-one hand-holding to get you through this whole process to where you want to be.
I think that's the end of the program, except why don't you give us your website address if you have one?
Okay, that's the end of the program. So our web address, if you go to I think gethealthy.org. My presentation went off and I can't read this tiny writing. My vanity's catching up with me. You can also, if you check out the Swalahec website, swalahec.org or .com, swalahec.com, you'll be put on our webpage, and right up at the top in the front is how you can get in touch with a navigator and find out more about what we're doing.
Terrific. Thank you, Doc.
Awesome. Thank you for having me.